In New Jersey, Black women are dying at disproportionately higher numbers due to pregnancy and pregnancy-related complications. This video explores contributing factors and potential solutions from patient and doctor perspectives. Maternal mortality is on the rise across the United States for all women.
I believe New Jersey is currently in a Black maternal health crisis, and we need to make more people aware of that. Black woman with a PhD, doctorate level education is just as likely to pass away as a white woman with an 8th grade education. So I think it's important to be clear that Black women cannot out-educate or out-earn themselves out of this disparity. So there is a significant issue with being heard and listened to and those issues being addressed. So that's the #1 issue.
There is nothing about race that should make you predisposed to be more ill or to die. There's nothing about race itself. We have a culture that gets confused as, race, racism, and racist. It's a situation where statistically the statistic exists. So, what are we going to do to put you in a more, positive, situation?
It's been a roller coaster. It was really sweet because I did actually get blessed with a doctor who heard me, did the extensive work to, get the care I needed. I was stressed a lot just because I was new to being a mom with my first son, and I didn't know what to expect. I just went with the flow. I just thought everything was like the movies you see. You just go through labor and you push. No, I really needed extra attention because I didn't know.
Certainly the social, determinants of healthcare, come into these issues.
I did express those things to the nutritionist, and it was brushed off as if, well, I'm telling you what's good for this scenario. And on my end, it's like, well, I'm telling you I don't eat that. To say, okay, let's map out your day. What does your day look like? What do you eat on a regular? You didn't ask me what I eat. You just told me what I need to eat.
We know that implicit bias plays a role. So all of the things that we are exposed to in media and untruths that we hold, stereotypes about other groups, impact the way we deliver care.
Sometimes the judgment is what needs to be dropped off. Mary didn't come today for her appointment today. Well, Mary didn't come for her appointment today. That doesn't necessarily mean that Mary is not compliant. So when the staff called and said, "Mary, where are you?" and she said, "I didn't have transportation," it's just a statement of fact. Okay, it's not a judgment.
The comfort level of talking with your practitioner and your doctors, right? They have to make you feel as though you can ask them the questions.
Especially being a Black woman, and you go through a lot already.
We really need to work on not just sharing the disparities and how bad they are, but we need to also be including solutions of how we're going to address these issues. And so where everyone is allowed to practice very differently, we don't have standardized care, and that allows people to kind of fall off and not get the assistance that they need. Very important that we don't shift blame to our patients. Often the narrative is that Black women are unhealthy. They don't attend their appointments. They don't enter prenatal care on time. And what we know is controlling for all of those situations that Black women are still going to have these outcomes. And so we need to shift from a more blamed race narrative to really looking at solutions-based assessments and really looking at what are our assets in our community, what are things that we could be doing to better improve these outcomes, educating on the post-birth warning signs, really understanding what those complications look like in the postpartum period. And that's really not on the patient to have their own understanding of that. We should be teaching that information as health providers. But I would also add including Black fathers in that scenario. Often they are placeholders in the room and not engaged in conversation. They are the advocate for their wife or partner.
People need things that decrease the stress in their life. They need to have a living wage, okay? They need to have things that de-stress, okay, them at a time where stress can impact and have adverse outcome. What our our thoughts are about certain situations, and that people should be open to that, that is just simply a statement of fact. It is not an accusation of someone being racist, okay? It is just a matter of saying we have a disparity of outcome. We think that this can be a factor. These are techniques that we can use to close this gap. Let's all be partners, in that. And for people to go back to some of the basic things, reasons why they went into healthcare, to help people, no matter what, the person that is in front of you is a fellow human being needed in the event something does occur, that we can be the best that we can be to give them the outcome that they need and deserve.
So please do not look at our color, at our clothing, at our style. Just look at how we communicate with you. When you see something that's not right, sometimes you do have to put the foot forward and say, hey, hold on, let's look at this. Let's look at another way we can make it fair.
It's something about knowing that you're heard where you feel more confident and you're ready. So saying I'm concerned really gets their attention and they'll look.
Help restore childbirth to a position of being one of the, happiest times of your life rather than one of which you are fearful for your life.